We do like a quick assessment of their mood experiences, like I'm happy.
When you meet Ashley
My
Williams,
focus is a 3.
the term active feels like an understatement.
There's an algorithm here that recommends resources from our resource library that meets them exactly where they are.
After all, she spent the last few years launching a tech startup,
We're also collecting emotional intelligence data.
a company that uses software to help young people with their emotional health care, Clymb.
It was just an issue close to my heart.
The goal is to help children develop emotional intelligence and resilience. And ironically, that was a skill set she was forced to put to the test in March of 2020.
I'm living my life, and then all of a sudden, I can't get out of the bed on some days.
The world had just heard about a deadly virus, and Ashley developed peculiar and severe symptoms.
I didn't want to get out of bed. I just felt not well. I didn't have a fever. I had some digestive issues, a really bad headache, and it sort of spiraled.
Her family took her to Johns Hopkins University Hospital, one of the few places in early 2020 that could test for COVID, and she came back positive.
I found out that I had this virus, and it was like a really big deal because at the time when people were going into the emergency rooms, they were not necessarily leaving out of them.
She went home and started to recover, and eventually she tested negative, but
I was chronically lethargic. I had incredibly bad brain fog, just difficult. My body would be racked with physical pain. I would have pain that would sort of radiate through my legs and my fingers. My joints ached. Sometimes if I ate, I would vomit or I would get ill.
it's what doctors now refer to as long COVID. So let's verify. What do experts know about long COVID? To get a basic idea, we went to the CDC and the World Health Organization. Both define long COVID as having a range of continued or new symptoms that can last weeks or months past your initial infection, with the WHO saying you've got long COVID when you hit that 3-month mark.
The most common is fatigue, the sort of inexplainable fatigue.
Dr. Priya Dougal is an epidemiologist at the Johns Hopkins University Bloomberg School of Public Health. And for the last 2 years, like most medical researchers, she and her colleagues have studied COVID.
And then early on, we also started to see people reporting symptoms that were long-term. And so that was another question is, are there a lot of people really having long-term symptoms? Can we try to answer some of those questions? Can we get at it?
And that's when they came up with the idea to do a long COVID study, a simple online-based questionnaire that anyone can take. And one of the first people to take the study
How many times have you tested positive for COVID-19?
was Ashley Williams.
What type of test did you take when you tested positive for COVID-19 the first time?
The survey asks a number of different questions and then gets to the heart of it. What are the symptoms or conditions you continue to deal with? And Ashley has a laundry list.
I found out that I ended up developing celiac disease. What? I also developed moderate asthma. Then I also developed fibromyalgia, which is sort of like this neurological issue that can send waves of pain through the body.
Dr. Dougal says their goal is to get 25,000 people to participate. That way they have a broader idea of what COVID long haulers experience.
We want to figure out these anomalies, like why are some people different than others?
Despite the symptoms, Ashley's back on track, working tirelessly on her emotional healthcare startup, but also trying to help people just like her.
My hope is that through the participation of the study, that information comes forward that can help so people won't have to suffer in the way that I suffered.
With Verify, I'm Matt Gregory, WUSA9.